into assessment of the skin, head, ears, nose and throat, and eyes. And this is Ruth. Hello, Ruth.
Hi.
I will be assessing your skin, your head, your ears, your eyes, your nose, and your throat today for the complaint you came into the clinic with. So basically, we're going to start with assessing your eyes. This is called a Snelling chart, and basically it's just to tell me more about your vision. And for this, I'm going to have you use this index card. We'll walk over there, and I'll have you cover your left eye with the card, and I'll point, and just try and read as much as you can without straining your eyes or without using a lot of effort to read, okay?
Yes, sir.
And I see you're using glasses. Is your glasses for reading or for vision?
For vision.
Great. Okay, we'll walk over to this part, 20 feet. Okay. And you can use this to cover your eyes. There you go. Okay, what letter is this?
E, P, F.
And you can read from left to right.
Okay. T, O, Z.
Great.
L, P, E, D.
Good.
P, E, C, F, D.
Great.
E, D, F, C, Z, P.
Okay.
F, E, L, O, P, Z, D.
Okay.
D, E, F, P, O, T, E, C.
Okay, and can you try this?
L, E, F, O, D, P, C, T.
Okay, great. Thank you. And my patient's vision is great at 20/20 vision. And we'll move over to the next portion of this assessment. Thank you. Hello. Welcome again. This is in continuation of the assessment of the head, skin, eyes, ears, nose, and throat. My patient is seated comfortably for this position, for this assessment. And I'm just going to quickly assess you again for the skin, head, ears, eyes, nose, and throat. Okay? And looking at my patient's skin is homogeneous. And before we started the assessment, I did, while introducing myself to her, touch my patient's skin. Her skin is warm. Temperature recorded was at 98.6. Okay, I'm just going to go ahead and palpate your scalp starting from the head. I'm feeling for any masses, any lumps. Okay, there's no lesion, no bumps, no lumps on the patient's scalp. Skull is normocephalic. And looking at the patient's ears, just going to put your head back for a second. Okay, they are symmetrical bilaterally, no deformities. And the ear color is even with the skin tone. Okay, I'm just going to look at your eyes. Look up. Okay. The conjunctiva is clear, not inflamed. And the sclera is white. And the eyebrow has even hair distribution. And I'm just going to palpate the zygomatic process. Any pain?
No.
Okay. Any tenderness? Okay. Okay, and there's no pain or tenderness along the temporal artery. Okay, moving down. I'm going to inspect your nose. Okay, and there's presence of nasal hair bilaterally. There's a little bit of mucosa in the nasal region. And what I'll have you do is to block one of your nose with one hand, okay? And breathe in. Any obstruction? Okay, breathe out. Okay, great. And try the other nose. Breathe in, breathe out. Okay. Airway is patent at this time. And I see no lesions or nodules in the nasal passage. Okay, the next thing I'm going to do is to assess your oral cavity. Okay. I'm just going to put on gloves for hygiene purposes. I'm just going to use this to press your tongue down. Okay, stick your tongue out. Okay, great. And I'll just have you bring your tongue out. I'm going to grab this with the tongue. Just relax your tongue for me. Open. Okay. My patient's tongue looks great, pink. There's saliva underneath the below the tongue. Welcome back. This is in continuation of the assessment of the skin, head, ears, eyes, nose, and throat. Okay, continuing this assessment, I had already assessed my patient's skin. Her skin is warm. Her skin color looks toned, even distribution, no hyper or hypopigmentation. Okay, Ruth, we're going to continue with the assessment, and basically I'm just going to assess your scalp, assess your head, your face, and your throat area, okay? We'll start the assessment by palpitating the scalp and the skull. I'm just going to feel any pain,
No,
any tenderness?
No, no.
Okay. There's no visible masses, lesions, or nodules on the scalp. The head of the shape of the head is normocephalic. There's no tenderness at this time. Okay, next thing I'm going to do is to assess your face. I see the ears bilaterally symmetric, even color with the skin tone, which is great. And looking at the face, the eyebrow has even hair distribution. Face is symmetric bilaterally, no tics, no twitches. Patient looks relaxed. Okay. Next thing I'm going to do is to assess your eyes. Okay, look up for me. And the conjunctiva looks great, no inflammation in the conjunctiva. And the sclera is white. The next thing I'm going to do is to assess your nasal passage. And that is your ear, your nose, excuse me. Okay. And there's even hair distribution in both nerves, no lesions, no nodules, and the nasal passage has some mucus in it, but no drainage at this time. Okay, I'm going to palpate the temporal artery. Any pain?
No, no.
Any tenderness?
No, no.
Okay. Any pain?
No, no.
Any tenderness?
No, no.
I'm also going to palpate the TMJ. I'm just going to palpate and just open your mouth and close for me. Close, open, Close. Any pain?
No.
Okay. And palpating, there are no lesions, no nodules. Smooth movement without any limitation or tenderness at this time. Okay, next thing I'm going to do is check your oral cavity. And just for hygiene purposes, I'm going to put on my gloves. I also have some 2x2 and a tongue depressor. Open your mouth for me. Stick your tongue out. Great. Okay, the tongue appears midline. I'm just going to use this. Pull your tongue back in. Depress your lips and stick your tongue all the way out. Great, okay. And lift your tongue to the roof of your mouth. Great. Okay. And I'm just going to use this to grab your tongue, stick it out for me. And I'll shake from side to side. Thank you. Great. Okay. Looking at the dorsal surface of the tongue, it's roughened from the papilla. The ventral surface is smooth, glistening. There's vein present, there's saliva present, healthy looking, no bruises, no cuts on the tongue. The teeth looks healthy, no gingivitis. Know that the teeth is white and I don't see any cavities. Okay. I'm moving on now to the fundoscopy test. And basically what I want you to do is just look straight ahead at the marking on the wall. I'm just going to check this eye one more time. Okay, I just did the fundoscopic exam. The optic lens, there's no inflammation. The optic lens is creamy yellow. It's round and its margin is pretty much distinct and sharply demarcated. Okay. Next thing I'm going to do is to palpate your thyroid. And I'm just going to move the chair forward a little bit for this so I can get behind you. Okay. Okay, let's sit down. And for this examination, I'm going to have my patient sip a cup of water. So if we could pause the video. I'm also going to assess for the pupillary reflex on my patient to check for accommodation. Okay, just look straight ahead for me. Okay. And looking at the reflex, the pupils are equal reactive to light and accommodation, and both of them constricts equally. Okay, next thing I'm going to do is to assess the thyroid gland. And if I can just have you swallow for me. Okay, and I see, oh, my patient is hungry. I can see the pharynx move up and down as my patient swallowed. I'll also have you sip a cup of water. And there's movement present. Let me have you hold on to this one more time. What I'm going to do is to palpate the thyroid. going to displace to one area and have you swallow. Swallow. Okay. Okay, have you sip from the water. And then palpating the thyroid, there are no nodules noted as well. Yeah, the last component of this assessment is to assess for the whisper to do the hearing conduction. So first thing I'll do is I'm going to cover one of your ears and you tell me what I say and you repeat out loud for me, okay? Okay. I'm going to block with my finger the triggers. What did I say?
Blue moon. How are you?
Great. Patient hears bilaterally to both ears. And the next test we'll do is the Weber test. I'm going to strike this conduction test and you tell me if you hear the sound bilaterally in both ears.
Yes.
Did you hear it more in one ear or less?
I heard it equally in both ears.
Equally, great. Okay. And I'm also going to do the rhyme test. Are you still hearing it?
Just stopped.
You just stopped? Okay. Are you still hearing it?
Yeah.
Let me know when it stops.
Okay. It stopped.
Okay, great. Also going to do the same thing on this here.
It stopped.
Okay. Still hearing it?
Mm-hmm.
Let me know when it stops.
Okay. It stopped.
Okay. Sound is heard twice as clear bilaterally, and this is positive for the rhyme test. And this concludes the assessment of the skin, head, eyes, ears, nose, and throat. Thank you.